Hello everybody, and thank you for tuning into this channel. Today we're going to be talking about genital herpes. Now this is a very common infection, but a lot of people are embarrassed to discuss or even bring up even with their physician unless they have an acute attack. It's estimated that at least 1 in 5 adults in the United States are infected with the virus, but many people have mild or no symptoms and don't even realize they're infected. After getting infected, many people have recurrent episodes of ulcers for several years, but although the infection can stay in the body for many years, the symptom outbreaks become less frequent and less intense with time. It's important to discuss the infection with your partner if you have it, and to use condoms during intercourse. In these next few slides, I'm going to discuss herpes itself and the infections that occur and the symptoms from the infection and the possible treatments that can be carried out. There are two types of herpes simplex virus, imaginatively called type 1 and type 2. Herpes simplex type 1 goes through transmission orally and causes cold sores or mouth ulcers. Herpes simplex type 2 is generally transferred through sexual contact and causes genital herpes. Now, it must be remembered that type 1 can also cause genital herpes and type 2 can also cause oral herpes, and we'll discuss this further on. The symptoms of genital herpes are quite variable. It can range from mild or no symptoms at all through to painful blisters and ulcers, and many people might actually have genital herpes but never experience symptoms. The initial episode is usually the most severe. It tends to be more severe in women than in men and usually lasts 2 or 3 weeks. In women, these are the areas most commonly affected, and in men, these are the areas most commonly affected. The symptoms are usually painful blisters that crust over and keep recurring over 4 to 5 days, with the whole infective episode lasting 2 or 3 weeks. There may also be tender swollen lymph nodes in the groin, as well as flu-like symptoms and joint pain. A small percentage of people can develop headache, nausea and vomiting, or difficulty urinating. After the initial outbreak, the virus travels to a bundle of nerves at the base of the spine, where it remains inactive, and this is often called the latent stage. Recurrent episodes tend to occur when the virus travels back to the skin via the nerves and causes an outbreak at that point. Now, these areas are usually at the same site as the first attack, but can be very separate and very far away from where you had the initial attack. Genital herpes recurs frequently in many patients, especially those with herpes type 2. Over the time, the infections become less severe and less intense. However, it's possible to also have a recurrence many years after the initial attack. Now, this can be quite distressing for people, especially if they've never had the initial symptoms. There are usually triggers for the recurrence, and these include illness, sunlight, fatigue, menstrual period, and stress. Over time, people begin to understand their attacks, and usually they begin to notice the warning signs prior to the attack, and these can happen in up to 50% of people. You usually get itching, sensitivity in the buttocks or legs or hips, and that usually gives an indication that attack may be coming. The diagnosis of genital herpes is based on an individual's medical history, the signs and symptoms, as well as the results of tests. Now, we've got several diagnostic tests for genital herpes, but the best of these is the PCR. This test is very sensitive for identifying herpes in cells and secretions from the urinary and genital tracts. The next option are blood tests. Now, these are used when there are no visible ulcers at the time, but the patient has a history of genital ulcers or believe they may have been infected with herpes in the past. The blood test identifies the antibodies against a particular virus, so it will tell us whether it's type 1 or type 2. You must remember that having a positive test for these antibodies indicates that an infection had happened at some time in the past, although we cannot say for sure whether that was recent or many years ago. The last option is a culture test, which determines if there's herpes simplex in blisters or ulcers. However, the test is only sensitive in about 50% of people. There are 3 antiviral medications that are used for treating genital herpes. The first of these is the oldest one, and it's very well known. It's called acyclovir, otherwise known as Zovirax, which you can buy in most pharmacies. The next is famciclovir, which is Famvir, and valcyclovir, Valtrex. They're usually taken by mouth or as a cream on the area, and usually have a very good effect. The dose and length of treatment really depends on whether the outbreak is a first episode or a recurrence. In the initial episode, the treatment is usually for 7 to 10 days with an antiviral medication. You can also have episodic therapy, which is carried out for recurrent attacks and may be recommended if you have fewer than 6 outbreaks a year. Suppressive therapy is something we consider for people who have more than 5 to 6 outbreaks a year. The advantage is that it reduces the frequency and duration of recurrence and can reduce the risk of transmitting herpes simplex to a partner. It may be recommended if you have, as we said, 6 or more recurrences a year or have a weakened immune system, such as having been diagnosed with HIV. It can also be an option if you're in a sexual relationship with a partner who doesn't have a history of genital herpes, to reduce the risk of transmission. The last option we have is no treatment. It's not necessary to treat a recurrent episode of genital herpes. It's usually self-limiting and will resolve over about 10 days. Now we need to discuss the risks of transmission of genital herpes. The virus is most likely to be transmitted between partners during oral, anal, or vaginal sex. It's also possible for a patient to develop genital herpes after exposure to a cold sore on an infected person's lip via oral sex. There's no risk of becoming infected after exposure to environmental surfaces such as doorknobs or toilet seats or bed sheets. The last few points I want to bring up are the risks of transmission to the baby in pregnant women. Now, this is obviously an area of significant concern to pregnant women. If you have your first outbreak near the time of delivery, you are at a higher risk of transmitting it to the baby. And for this reason, many people recommend cesarean section in this situation. It's also important to make sure that you've told your doctor that you've had a history of genital herpes in the past, and you must also tell them if you're having an outbreak near the time of delivery, so they can discuss with you the option. If it's a recurrent outbreak, some schools of thought say you can go ahead with a normal delivery, but most people will err on the side of caution and suggest a cesarean section. If you're having recurrent outbreaks in the pregnancy, it is important to consider the possibility of using acyclovir if you're having 1 or more recurrences during the pregnancy. As we said, you may need a cesarean section for delivery. And the final point is that if you have had no history of genital herpes, but your partner has a history of cold sores or genital herpes, you should avoid oral, vaginal, or anal sex in the last trimester, the last 3 months of pregnancy. I hope this has been helpful, and if you are happy with this, please leave me a note in the comments to let me know, and I wish you all a great day.